And so this is one of the modern debates, isn't it, about how we pathologise ourselves. You know, we're all very psychiatric literate these days, all very literate in mental health services or mental health symptoms. But I guess there might be a question about things being pathologised that are perhaps part of normal behaviour, and what effect that has on somebody's development or identity or how they relate in the world.
Do you worry that in some places psychiatrists have, in the face of that complexity, just kind of swept a lot of it under the rug and just try to be really, really try and treat all of these symptoms as an illness, just like any other kind, just like a physical illness, for example, and really, as a sort of reaction to this complexity, really treat things at the surface level? Do you think that's happened at all within the profession?
Yeah, I think that happens all the time. I mean, in a way, it's a defence against anxiety and helplessness, and also a will to help. I mean, psychiatrists are generally people who care and want to make a difference, and it's also, as we said, you know, about one's adherence to different sorts of models as well. So the way that people see the world, in a way, like it, you know, in a way, it's about your philosophical position, actually, about suffering and sadness and families and all sorts of complicated things. And as you say, I mean, that doesn't mean if you hold that view that you can't agree on severe pathology. In fact, you'll find psychiatrists agree sort of very well on severe pathology, and we'll all have sort of fairly similar ways of dealing with it. But that's probably about 10 to 15% of what we see, and then there's sort of everything else.